Welcome to Chapter 16, Oncology and Cancer Terms. In this chapter, we're going to learn about the combining forms, prefixes, and suffixes related to oncology and cancer. You're going to understand general terms related to oncology and cancer and the different body systems. You'll be able to define some common medical terminology used to evaluate and identify cancer and cancer progression, and you'll learn some abbreviations for terms related to oncology and cancer. Combining forms, ablato to take away, bio for life, cancero or carcino for cancer, chemo for chemical or drug, cryo for cold, cyto for cell, Cario for nucleus, Laparo for abdomen, Leo for smooth, Leuco for white, Milano for black or dark, Onco for tumor, Patho for disease, Plazo for growth or formation, Radio for x-rays or radiation, Rhabdo for striated muscle, Sarco for connective tissue or flesh, Squamo for a scale-like structure. Prefixes that are going to be common in this system are dis for painful, difficult, abnormal, intra, within, mal for bad or poor, meta for change or beyond, neo for new, para for beside, trans for across or through. Suffixes in this section are gen for origin or production, genic for originating or producing, oma for tumor, opsy for a process of viewing, scopy for a process of examining and examination. General terms related to oncology and cancer that you're going to hear are benign, which means a non-malignant form of a neoplasm. Cancer, abbreviated uppercase CA, that's the general term for a group of diseases characterized by an abnormal, uncontrolled growth of cells. Cancerous is pertaining to cancer. Carcinogen is any cancer-containing substance or organism. Differentiation is the determination of how developed or mature the cancer cells are in a tumor. Dysplasia, that's the abnormal growth of tissue. In situ, that is in the original place or site without any expansion or spread. Invasion, that's the direct migration and penetration by cancerous cells into neighboring tissues. Lesion, that's the pathologic change in tissue resulting from disease or injury. Malignant means having the properties of locally invasive and destructive growth and metastasis. Metastasis, that's the spread of a disease process from one part of the body to another. Oncogenes are mutated forms of genes that cause normal cells to grow out of control and become cancer cells. Oncogenic is causing or being suitable for the development of a tumor. Recurrence is the return of cancer after all visible signs of it have been eradicated previously. Remission is the lessening in severity of disease symptoms or the period of time when a cancer is responding to treatment or when it's under control. Types of tumors that you're going to hear commonly are adenocarcinoma, that is the malignant neoplasm composed of glandular tissue. An adenoma is a benign neoplasm composed of glandular tissue. A carcinoma is the malignant neoplasm of any epithelial tissue. A fibroma is a benign neoplasm of fibrous connective tissue, and a fibrosarcoma is the malignant neoplasm of deep fibrous tissue. Here you see two different types of tumors. On the left, the adenocarcinoma, and on the right, the fibrocarcinoma. fibrosarcoma. Types of tumors, a lipoma is a benign neoplasm of adipose or fat tissue. A liposarcoma is a malignant neoplasm of adipose or fat tissue. Malignant neoplasm is a tumor that invades the surrounding tissue and is usually capable of metastasizing, and it can be located in any organ or tissue in the body. A melanoma is a tumor characterized by a dark appearance, most commonly occurs in the skin or in the eye. And here are two types of tumors, the liposarcoma on the left and the melanoma on the right. A neoplasm or tumor is the abnormal growth of new tissue into a mass, and it can be either benign or malignant. A neuroma is a tumor derived from nervous tissue. A myeloma is the tumor composed of cells derived from bone marrow. And a sarcoma is a malignant neoplasm of connective tissue. And here on the left you see the neuroma, and on the right the sarcoma. Basal cell carcinoma, or uppercase BCC, is a cancer that begins in the lowest layer of the epidermis of the skin. Kaposi's sarcoma, that's a type of cancer found in the tissues under the skin or mucous membranes that line the mouth, nose, and anus, and this is more commonly seen in patients with AIDS. A melanoma of the skin is a malignant skin cancer that arises from the melanocytes in the epidermis, and it's usually caused by exposure to ultraviolet radiation or the sun. Squamous cell carcinoma, or SCC, is a cancer that begins in the squamous cells, and it's located in the upper levels of the epidermis of the skin. And here we can see a few different types of skin cancer. A is the squamous cell carcinoma, B, the basal cell carcinoma, and C, a melanoma. Cancers related by body system. So a GIST tumor is the gastrointestinal stromal tumor, and it's a rare cancer, and it affects the digestive tract or nearby structures within the abdomen. Cancers of the urinary system are malignant neoplasm of the bladder, and that's a cancerous tumor of the bladder. A nephroma is a tumor of the kidney. Urothelial carcinoma, or a transitional cell carcinoma, is cancer arising in the urothelium lining of the urinary tract. Wilms tumor is a rare type of kidney cancer that affects children. Here we see a picture of a Wilms tumor. Cancers of the blood and immune system include Hodgkin's disease, and that's the abnormal malignant enlargement of the lymph nodes, the spleen, and the liver, and it's indicated by the presence of Reed-Sternberg cells. Leukemia, that's a cancer of the blood indicated by a malignant increase in the number of white blood cells. A lymphangioma is a mass or a tumor of the lymph vessels. Here you can see the Reed-Sternberg cells as seen in Hodgkin's disease. Additionally, a lymphoma is a tumor of the lymphoid tissue, including the lymphocytes and plasma cells. An NHL, or a non-Hodgkin's lymphoma, is a lymphoma other than Hodgkin's disease. Cancers in the respiratory system include a bronchogenic carcinoma, and that's a carcinoma that arises from the mucosa of large bronchi. Mesothelioma is a carcinoma of the mesothelium lining of the lungs or the heart, and it's usually associated with exposure to asbestos dust. An Oat Cell Carcinoma is a highly malignant form of lung or bronchogenic cancer in which the cells appear small and rounded under a microscope. And here we can see the Oat Cell Carcinoma and the tumor projecting into the bronchi in this picture. Cancers of the female reproductive system, or DCIS, is a ductal carcinoma in situ, and that's a breast cancer that is confined to the ducts and hasn't spread into the tissue of the breast. Germ cell tumor, that's cancer that begins in the egg producing cells of the ovaries. Stromal cell tumor, that's cancer that begins in the cells of the ligaments of the ovaries. And here you can see progression to ductal carcinoma in situ and an invasive ductal carcinoma of the breast. And that's a really interesting picture there. Nervous system cancers associated with that system is an astrocytoma, and that's a tumor that arises from small star-shaped cells in the brain and spinal cord. A glioma is the cancer that arises from the glial cells of the nervous system. And a medulloblastoma is the cancer that develops from the primitive nerves in the cerebellum. Meningioma is a benign and slow-growing tumor of the meninges, and neuroblastoma is a cancer of the nervous system. Cancers of the sensory systems are a glomus tumor, and that's a benign but locally invasive tumor arising out of the glomus tissue found in the middle ear, jugular bulb, and carotid artery. An intraocular melanoma is a malignant cancer that forms in the tissue of the eye. Retinoblastoma is a malignant ocular tumor of retinal cells. Cancers in the musculoskeletal system include a chondroma, and that's a common benign tumor arising from cartilage cells. Chondrosarcoma is a large malignant tumor arising from cartilage cells. A Ewing tumor, or a Ewing sarcoma, is a malignant tumor found in bone or soft tissue. Additionally, a giant cell tumor is a tumor of the tendon sheath that can be either benign or malignant. A leiomyoma is a benign tumor of smooth or non-striated muscle, and a leiomyosarcoma is a malignant tumor of smooth or non-striated muscle. Liposarcoma is a malignant tumor of adipose tissue, and it occurs in the retroperitoneal tissues and the thigh. An osteofibroma is a benign lesion of bone consisting chiefly of fairly dense, moderately cellular, fibrous connective tissue, and an osteosarcoma is a faster growing malignant type of bone cancer that develops in the osteoblast cells that form the outer covering of the bone. And here's a picture of the osteosarcoma of the left femur showing an acute fracture there as well. Rhabdomyoma is a benign tumor of striated muscle. Rhabdosarcoma is a highly malignant tumor of striated muscle. Cancers in the endocrine system include a MEN, or MEN is the multiple endocrine neoplasia, and that's a group of disorders characterized by functioning tumors in more than one endocrine gland. Pheochromocytoma is a vascular tumor of the adrenal gland. Pituitary adenoma is a benign tumor arising in the pituitary gland. And here is a pheochromocytoma pictured here. Some lab tests common in the system. I'm going to stop here and then we'll move to, the next system, or continue with the system starting at the lab test.